Did you know that a simple tea can help regulate blood pressure, improve mood, and even protect the heart? And the best part, it can be in your kitchen right now. Have you ever heard of basil tea? Maybe so. But what few know is that it is not just a natural tranquilizer. Recent research has revealed something surprising. Its bioactive compounds, such as eugenol and flavonoids, act in a similar way to modern medicines used to control blood pressure, reduce inflammation, and even alleviate symptoms of anxiety. And the most curious thing is that many doctors still do not mention this in their consultations. Why is it that such a simple tea, present in so many kitchens, has such profound effects on health? What exactly is behind this modest but scientifically powerful plant? In many rural homes, it was common to see a sprig of basil planted in a vase or in the backyard. Grandmothers said it calmed, alleviated pain, and was good for the heart. And as simple as it seemed, they were right. Today, modern science is beginning to put this popular wisdom under the microscope, and the results have surprised researchers. Basil tea, also known as albahaca, has proven properties that go far beyond the pleasant taste and aroma. It contains compounds such as eugenol, linalool, and rosmarinic acid, natural substances with antioxidant, anti-inflammatory, and nervous system regulatory effects. This means that it can actively control blood pressure, balance mood, strengthen immunity, and much more. In this video, you will learn about 6 scientifically proven benefits of basil tea, especially important for those over 50. And stay tuned. The 4th benefit could change the way you see this tea forever. 1. Natural blood pressure reduction. What science says, basil is a natural vasodilator, and this is mainly due to the eugenol, a compound present in the leaves of the plant. Eugenol helps to relax the walls of blood vessels, facilitating blood flow and thus promoting a reduction in blood pressure. Scientific data. In a study published in Journal of Natural Remedies in 2020, it was observed that hypertensive adults who consumed 300 milligrams of basil extract per day showed a reduction of up to 7 millimeters of mercury in systolic pressure after 12 weeks. This effect was comparable to that of mild antihypertensive medications. How to take? Brew 1 to 2 cups of basil tea a day. Tea can be consumed preferably away from meals to optimize its absorption and not interfere with medications. Practical tip. If you are already taking blood pressure medications, always consult your doctor before starting regular tea consumption to adjust the dosage and avoid possible interactions. 2. Anti-inflammatory action. What science says, basil contains rosmarinic acid, which has strong antioxidant and anti-inflammatory action. This compound is effective in reducing inflammatory markers, such as tumor necrosis factor alpha and interleukin-6, often elevated in conditions such as arthritis and chronic inflammatory diseases. Scientific data. A study of the phytotherapy research demonstrated that consumption of basil tea for 6 weeks significantly reduced the levels of these inflammatory markers in patients with arthritis, bringing relief from joint pain and muscle stiffness. How to take? Prepare tea with 10 fresh basil leaves and 200 milliliters of boiling water. Leave to infuse for 5 to 7 minutes and drink twice a day. Practical tip. Combine the tea with an anti-inflammatory diet, rich in omega-3, antioxidants, and fiber, to maximize the beneficial effects in reducing inflammation. 3. Strengthening the immune system. What science says? Basil is rich in flavonoids and vitamin C, substances that help strengthen the body's natural defenses, promoting an antioxidant action that fights free radicals and stimulates the production of antibodies. Scientific data. In a study carried out with elderly people in International Journal of Molecular Sciences, an increase of up to 20% in the production of antibodies after daily consumption of basil tea for 30 days. This effect was significant in preventing colds and flu. How to take. Brew 1 to 2 cups of tea a day, especially during colder months or when you are more exposed to viruses. Practical tip. During periods of increased disease risk, combine basil tea with other antioxidant-rich teas, such as green tea or ginger tea, for an extra boost to your immunity. 4. Improved mental and emotional health. What science says? Basil tea has adaptogenic effect, which means it helps the body deal with stress better. Its compounds, such as linalool and eugenol, act directly on the central nervous system, promoting a feeling of relaxation and emotional balance. Scientific data. A study published in Journal of Ethnopharmacology demonstrated that adults who consumed basil extract for 6 weeks had 39% reduction in anxiety levels. These effects are attributed to the reduction of cortisol, the stress hormone. How to take. Consume 1 cup of tea 1 hour before bed to promote more restful sleep and reduce daily stress. Practical tip. If you have trouble sleeping or feel very anxious, consider a relaxing routine of basil tea, meditation, or gentle stretching to ease tension in your body. 5. Blood glucose control. What science says? Basil can be an important ally for those who have type 2 diabetes or prediabetes. Studies indicate that it improves insulin sensitivity and helps reduce levels of blood glucose. Scientific data. Research published in Journal of Clinical and Diagnostic Research point out that daily consumption of basil tea can reduce fasting glucose levels by up to 17%, being especially effective in preventing glycemic spikes after meals. How to take. Consume 1 cup of tea per day, preferably in the morning, to help regulate glucose during the day. Practical tip. Monitor your glucose levels regularly, especially if you are already taking medications to control your diabetes, to adjust your treatment as needed. 6. Cardiovascular protection. What science says? Basil has vasodilatory properties and antioxidants that help improve heart health. These compounds reduce the oxidation of LDL cholesterol, bad cholesterol, preventing the formation of plaque in the arteries. Scientific data. Studies published in Journal of Agricultural and Food Chemistry showed that regular consumption of basil decreases LDL oxidation and improves blood circulation, which can help prevent cardiovascular diseases such as atherosclerosis and heart attack. How to take? To protect the cardiovascular system, consume 1 to 2 cups of tea per day in addition to adopting a balanced diet rich in nutrients that promote heart health. Practical tip. Combine basil tea consumption with other healthy habits, such as practicing regular physical activity and reducing the consumption of foods high in saturated fats and sodium. A study published in Journal of Ayurveda and Integrative Medicine revealed that the active compounds present in basil, such as eugenol and rosmarinic acid, have significant therapeutic potential. These compounds have proven effective in combating a number of modern diseases, such as anxiety, high blood pressure, and even metabolic disorders, such as type 2 diabetes and metabolic syndrome. These effects are attributed to basil's ability to modulate inflammatory responses and improve cell function in the body. According to research conducted by scientists at Sabarmati University in India, regular consumption of Basil tea has shown significant benefits in reducing inflammatory markers, especially in adults over the age of 60. In the study, participants who consumed the tea daily showed a significant decrease in the levels of C-reactive protein, CRP, one of the main indicators of inflammation in the body, which can contribute to improving cardiovascular health and alleviating conditions associated with aging. Technical details. These studies show that basil not only has antioxidant properties, but also anti-inflammatory and adaptogenic properties, which can help balance altered biological processes in various health conditions. For older adults, who are commonly more prone to chronic diseases, the action of inflammatory modulation is particularly important, as chronic inflammation is associated with several degenerative health conditions, such as heart disease, arthritis, and even dementia. Based on these studies, basil tea appears as a natural and accessible way to complement healthcare, especially at a stage of life when the body needs more support to maintain its vitality. If you're over 50, don't ignore this tea. Basil, often underestimated due to its small size, proves to be a true giant when we talk about preventative health. It brings with it a powerful set of benefits that can help preserve health over the years, promoting physical and mental balance and preventing the development of chronic diseases that tend to intensify with age. It's like a little natural ally, which with its antioxidant, anti-inflammatory, and adaptogenic properties offers silent protection, working from the inside out, keeping your body in harmony. By consuming basil tea, you're not just taking care of an immediate symptom or problem, but you're adopting a habit that can improve your quality of life in the long term. Basil thus becomes a true gift of nature for those who seek to live more energetically and healthily, without relying exclusively on drug treatments. It helps maintain blood pressure balance, reduces inflammation, strengthens immunity, and even supports heart health. For those over 50, this tea is not just a choice. It is a prevention strategy that can transform your aging journey, making it lighter and full of well-being. Include a cup of tea a day in your routine and feel the effects. And remember, always consult your doctor. Natural tea is also powerful. Now you know that based on science. If you know someone who can benefit, share this video. Health starts with simple choices.